So let's talk about contraceptives. Now, they're used to prevent pregnancy, and they all have different success rates, which I'll put up at the end of this video. You need to pick the one that suits you and your partner's circumstances the best. The ones you can pick from your local pharmacy are good old condoms. Now, they're one of the few ones that actually prevent you from getting an STI or a sexually transmitted infection. The other one we have is the morning after pill or the emergency contraceptive pill. Now, this needs to be exclusively given to you by your pharmacist. It is something that works best in the first 24 hours and can be used up to 5 days after the incident has occurred. Some of the other ones you've got is breastfeeding. There's a few rules there. You obviously have had to have a baby in the last 6 months, your periods can't have returned, and you must be exclusively breastfeeding every 3 to 4 hours. Another one is a fertility awareness-based method. Now, this is obviously when people know when they're ovulating and avoiding intercourse before, during, and after this. Another one is the withdrawal method. After that, everything is prescription only. So, the most common one is the combined oral contraceptive pill. Now, that uses estrogen and progesterone together to suppress ovulation from occurring, so there's no egg to fertilize. It can also be used for people's skin, as well as controlling irregular or heavy periods. Now, not everybody can take that one, so there's another one called the mini pill, which is progesterone only. Now, this one's a little bit more finicky. We have to take it basically at the same time each day to be a really effective contraceptive. There's a contraceptive ring, which can be inserted internally. Now, that's a combination again of estrogen and progesterone. It goes in for 3 weeks and comes out for 1. Now, you've got a diaphragm, which is a silicone cap that goes over the cervix and prevents anything from entering into the uterus to fertilize any eggs. You've got injections, which can be used every 12 weeks. You've got intrauterine devices, which can be inserted by a doctor or a specialist. Now, they last anything from 5 to 10 years. There's a copper variety and there's a hormone variety. And then you've got the implant, which is a rod that goes in and under the skin, mainly in behind the arm there, and that lasts anything up to 3 years. So, in general, you should be able to talk to your pharmacist about potential options for contraceptive, or talking to your GP, or another great source is family planning in your state. They're really good at all this kind of stuff as well. So if contraceptives have failed, we may be in a situation where we have an unwanted pregnancy. If this is the case, please talk to family planning as soon as possible. There are options available to you. They will discuss and explore those options with you.